Well, thank you. It's a pleasure to be here today, and I've really enjoyed these conversations about laparoscopic and robotic surgery. And I figured that time would be running short. I know there's still one more speaker who is a good friend of mine, so I want to make sure that there's time for that. So I geared my talk around a reality check. Great. I have nothing to disclose. I do want to thank the organizers of this session for giving me the easiest thing to debate. Dr. Dilhoff did a great job. I'm sorry she had to pick or be asked to do the robotic session, because this is about like telling stories that maybe get exaggerated a little bit, and we use some data for that. But it's like trying to say that because we have a robot that suddenly we're going to have better surgery, even though, as was mentioned, the incision sizes, the amount of open belly to the atmosphere, all of the things that come with minimally invasive approaches, the tools, the equipment, are exactly the same. I'm also grateful that I wasn't asked, as my friend Dr. Baker, to talk about open surgery, because this is even more of a difficult thing, where he's going to try and convince you that sending mail or packages by airplanes and sending messages through the internet is not really progress and shouldn't be done, and that we should stick with the tried and true delivery of packages through other means. So the reality check. Let's just stop for a minute. You've seen all of the data. In the interest of time, I'm not going to go through all those studies, but what makes sense? So if you look at open versus laparoscopic approaches, we would definitely, and I would put even robot here, so minimally invasive approaches to open, there should be different outcomes expected based on the incision size, the physiology of an open abdomen, the physiologic stress that's been measured, magnification, the lighting is different. And although the equipment is a little bit more similar now, early on, some of the instruments we were using laparoscopic were still not used during open procedures. It was still clamp and cut and tie. So what makes sense for laparoscopic versus robotic approaches? Well, they're really the same thing. It's the same number of incisions. It's, for the most part, the same procedure, although surgeons tend to change the steps a little bit to try and be efficient. And so with the minor differences that have been proposed, be expected really to alter patient outcomes. And so when it comes down to it, really what is consistently touted as the stable platform as an advantage, increased range of motion, and 3D visualization. But I would say those are kind of fallbacks, because you can't measure, we haven't measured those very well. But what would you expect if those were true? You would expect decreased operative time. I think we've shown, and there's plenty of studies that show robotic surgery is quite lengthy. Decreased blood loss, you could infer if that was less that it might be due to the stable platform and the range of motion and the 3D visualization, but that's going to be pretty hard to do, to measure. Would you expect decreased pain or length of stay or wound morbidity? You wouldn't. It's the same thing, and these advantages wouldn't necessarily do that unless you're missing complications. So in terms of a stable platform, open and laparoscopic, I wouldn't consider unstable. If the problem is shaky hands, should the solution be a $2 million robot? Why don't we just reduce coffee intake and maybe that would fix the problem? What about increased range of motion? Well, you know, it's necessary to tout that and have that because of the difficulty and the hassle with changing positions. Laparoscopic, you can change those positions very quickly. And so I think it's really more of a marketing ploy than very often necessary. I can change wherever the camera is in less than 10 seconds. You can't do that with the robot. 3D visualization. I think it sounds reasonable. It certainly makes no sense that we go from a 3D world walking around to then operating in a 2D world. But this is computer generated. It's not necessarily identical to the real world. And how are you going to measure the advantage? Not all surgeons tolerate that well, so I'm not really sure what the benefit of that is. So here's the proposed that I mentioned. Well, what would we do if we really wanted to see if those proposed advantages made any sense? We would look at loss of exposure from that stable platform. We would look at pass pointing of instruments into the liver or into important structures causing bleeding in the OR if 2D was really so bad. We'd also look at direct video analysis and operative time to assess the value of efficiency in the visualization, the motion, and the steady hand. What about cost? Well, I think this is still under evaluation, and this just has baffled me for the last 15 years. It is funny math for sure. It depends on who's doing the study and what they consider, but rarely will they actually account for the fact that it's a $2 million robot, there's pricey service agreements, and it costs money to replace these limited use instruments, and yet somehow they can come up with the math to say that they're equivalent. I need to go back to college apparently. I don't get that one. Access, there's hospital resource issues, there's multiple specialties that are using it. Loss of haptic feedback, and every robotic surgeon, and I have done plenty of robotic Whipples as well, compensate, they say, well, you compensate through other senses. I totally agree with that. And I would also argue that the 2D visualization of laparoscopic surgery, it's the same way. In my mind, I'm seeing 3D all day long when I'm doing a robotic or a laparoscopic Whipple. So how are we going to measure the disadvantage? I'm not sure of that. Multiple surgeons. Two-surgeon model is very common, either a very advanced trainee, such as a fellow or an attending, and that's not considered in the cost analysis. The lost opportunity cost is significant, especially if you have two attendings. So outcomes, I'm not going to go through the studies as I mentioned. I will just say that they're all horrible. They are all very biased, and that's either for or against laparoscopic or robotic. There's really no good trials for laparoscopic versus robotic head-to-head, and I would argue that they're probably not likely to be done because there are almost nowhere that does proficiently and is beyond the learning curve in both the laparoscopic and the robotic procedure. It's a very difficult thing to do. Study limitations, there's a lot of bias. There's surgeon bias, there's selection bias, a lot of different things. Ergonomics, poor ergonomics in surgery is a problem. Up to 90% of surgeons report pain, certainly more common in laparoscopy. And in robotic surgery, it improves, which is great, but doesn't resolve the problem. So while I tout that as a true advantage of robotic surgery, in my opinion, it's not necessarily the end of it. So reality, patient outcomes, there's advantages for both approaches. Marginal and inconsistent differences are repeatedly shown between laparoscopic and robotic Whipple, and I think will continue to be that way. They're highly dependent on surgeon ability, period. That is the end of the story. That is exactly why conversion rates are different, because you have surgeons who want to do it laparoscopic. They have no laparoscopic training. They don't do reconstruction. They don't do complex dissection in any other procedure. They hop into the case. They realize quickly they're out of their league. They convert until they decide to go to the robot, which is easier to use, and then they compare their institutional experience and show how the conversion rate is higher. It's not rocket science. It's very, very straightforward why that's true. I think for the surgeon, this is the reality. Shorter learning curve, robotic skills are similar and easier to learn than laparoscopic, and because they're similar to open. There's ergonomic benefits of a robotic approach and indirect patient outcome advantage for the robotic, as long as we have more surgeons able to offer it minimally invasive. So that's going to sound like I'm switching my tune, and it's all pro that. Cost. I think this is going to increase as technology improves, but I think that's okay. It's worth it. The future is bright, and I don't want to, again, switch my tune because I'm a fan of laparoscopic, and I think we should provide the appropriate training so that these procedures can be done just as equivalently with outcomes as robotic. But I think the incorporation of new technology is really where the future of robotics is. It's not about proving what the blood loss is with conversion rate. It's going to be about education and quality, machine learning, artificial intelligence, and while the laparoscopic companies, device companies need to up their game here, I think just the platform itself in robotics is going to allow us to implement those things much, much easier. Patient outcomes, I think the benefits will be seen, but it's not necessarily the robot itself. It's going to be the added on technology. Thank you very much.